Welcome to this video about short bowel syndrome, or SBS. SBS is a complex condition that arises when the small intestine is significantly shortened or damaged, hindering its ability to properly absorb nutrients. In this video, we'll explore what causes SBS, how it affects the body, its symptoms, diagnosis, treatment, and what the future holds for individuals living with this challenging condition. So, what causes short bowel syndrome? The primary cause is surgical removal of a large portion of the small intestine, often due to conditions like Crohn's disease, volvulus, a twisting of the intestine, mesenteric ischemia, blockage of blood flow to the intestine, or tumors. In newborns, necrotizing enterocolitis, a serious intestinal disease, can also lead to SBS. Rarer causes include congenital abnormalities, where the small intestine doesn't develop fully from birth. Now let's delve into the pathophysiology, or how SBS disrupts normal digestion. The small intestine is the workhorse of nutrient absorption. When a significant portion is removed, the remaining intestine struggles to absorb enough fluids, electrolytes, vitamins, and minerals. This malabsorption leads to a cascade of problems. The body can't get the energy and nutrients it needs. Increased transit time leads to dehydration and electrolyte imbalances. The colon may be overwhelmed with undigested food, causing diarrhea. The loss of specific parts of the small intestine can particularly impact the absorption of certain nutrients, such as vitamin B12 or bile acids. Short bowel syndrome is a relatively rare condition. While precise numbers are difficult to obtain, it is estimated to affect a small percentage of the population. SBS is most commonly seen in adults following extensive bowel resection due to conditions like Crohn's disease or vascular events. It is also a concern in infants who have undergone surgery to remove portions of the bowel due to necrotizing enterocolitis or congenital defects. Understanding the epidemiology is important for allocating resources and improving patient outcomes. The signs and symptoms of SBS can vary depending on the extent of bowel loss, the specific part of the intestine removed, and the individual's overall health. Common symptoms include chronic diarrhea, abdominal pain and bloating, frequent bowel movements, dehydration, fatigue, and weight loss. Because of the malabsorption, individuals may also experience malnutrition, leading to muscle wasting, vitamin and mineral deficiencies, and impaired growth in children. In severe cases, complications like liver disease, kidney stones, and bone disease can develop. Diagnosing SBS typically involves a combination of medical history, physical examination, and diagnostic tests. Your doctor will ask about your symptoms, surgical history, and other relevant medical conditions. Stool tests can help evaluate fat malabsorption and the presence of infections. Blood tests can assess nutrient levels and liver function. Imaging studies, such as X-rays or CT scans, may be used to visualize the remaining bowel and identify any structural abnormalities. In some cases, an intestinal biopsy may be performed to examine the lining of the intestine. While there aren't strictly defined types of short bowel syndrome, it's often classified based on the location and extent of the resection, as well as the presence or absence of the colon. For example, a patient with a jejunal-ileal resection, removal of both jejunum and ileum, will have a different set of challenges than someone with a jejunostomy, removal of the ileum and colon. The presence of the colon can significantly improve fluid and electrolyte absorption, affecting overall management strategies. Treatment and management of short bowel syndrome aim to maximize nutrient absorption, manage symptoms, and prevent complications. This often involves a multidisciplinary approach with doctors, dietitians, and nurses working together. Dietary modifications are crucial. Frequent, small meals, a balanced diet, and avoiding sugary drinks are key. Many patients require parenteral nutrition, which involves delivering nutrients directly into the bloodstream to supplement oral intake. Medications may be prescribed to slow intestinal motility, reduce diarrhea, and treat underlying conditions. In some cases, intestinal transplantation may be considered. Currently, there are no definitive ways to entirely prevent short bowel syndrome. However, minimizing the extent of bowel resection during surgery when possible is critical. Prompt diagnosis and treatment of conditions that may lead to bowel resection, such as Crohn's disease or mesenteric ischemia, can also help reduce the risk. For infants at risk of necrotizing enterocolitis, preventative strategies include promoting breastfeeding and avoiding premature introduction of formula. The prognosis for individuals with short bowel syndrome varies depending on the severity of the condition, the individual's overall health, and their response to treatment. Some patients are able to adapt to their shortened bowel and achieve a reasonable quality of life with dietary modifications and medical management. Others require long-term parenteral nutrition. Recent research has focused on developing new medications that stimulate intestinal growth and improve nutrient absorption. Glucagon, like peptide 2 or GLP-2 analogs, are examples of such medications. Intestinal transplantation remains an option for select patients who are unable to achieve adequate nutrition with other therapies. Ongoing research continues to explore innovative ways to improve the lives of individuals living with short bowel syndrome.